coming in, I thought it might be many more of you as physicians looking at investing, but I also am hearing a lot of entrepreneurs here. So I think I'm going to reverse the presentation, but most of the time, I think I was given 15 minutes, so I said no slides, not 15 minutes, and mainly to let you ask questions. I'm going to wear two hats. I joined Keiretsu Forum, which is a global angel group that has 49 chapters all around the world, and they invest in really all sorts of things, not just healthcare. About 2 years ago, because I've been involved in healthcare for 30 years, I saw how they were investing in healthcare through Keiretsu and the Band of Angels and LSA. Well, everybody will tell you the same thing. Healthcare is different. You cannot go in with the same assumptions you would if you're starting a new SaaS company or gaming company or whatever. So that's why I started Healthcare Angels, and we only monetize healthcare companies, whereas Keiretsu, as I say, is quite broad. So what I thought might be helpful to you all, especially now I'm going to talk first those who are entrepreneurs or thinking about being entrepreneurs, and when and how do you approach angels? Some of you asked at the break some of those kind of questions. I thought, okay, um, the way to think about money coming into a company, I know this is going to be counterintuitive. Take the least amount possible to get to a milestone. Why? Research all will tell you those who were given too much money, 90% of them don't make it. It's very difficult when you're given too much money because what happens is you scale too soon. So, one basic principle, start with family and friends, which I know many of you sound like you have done, and find the monies that you need to show, and they call it MVP, whatever you want, show that you have something that can work. Even if it's a step towards an ultimate 8-function offering, show something that can work. Most angels, what's happened in just the last 5 years, when I started at Keiretsu 15 years ago, the venture folks you'd see a fair number of ventures in the $1 to $5 million range. And then, of course, the larger venture folks were upstream. Well, that's changed. Now, venture people pretty much presume you should be with angels. I would say up until about 5 million now. And so that has changed a bit. That just means that when you work with the angel groups that you might start engaging, try to find those that are not just one-stop folks. In other words, many angels are individuals, and that's fine. It's critical to have them, but most of them won't come for a second round. And that's problematic for you who want to be the entrepreneurs. It's very time consuming. The average entrepreneur has 85 meetings to get $1 million. And that's in the Bay Area. It's much worse at other places. But it's a very time-consuming process. So what you don't want to do is go to an angel group, get $500,000 from 50 people, and then have to turn around and go to 50 new people for the next $500,000. So you want to be as strategic about your investing side as you are about your product development side. Get fewer, higher quality people who are likely to do another round. And how do you find that out? Now, I'm going to turn it to you all because we got experts there. How do you know whether the angel or angel group you're talking with are likely to do another round? It's fair game. You are scrutinizing the investor as much as they're scrutinizing you, and that's fair game. I have a company now. As I have to say, it sort of ticked me off because I'm on the investor side, and I'm bringing investors into this deal. It's a wonderful company. I'm excited for them, but anyway, I thought we were all set. Literally on the phone call. This is an Asian investor. And they said on the phone call, we're in for 100. I said, great. And all of a sudden I hear from the entrepreneur, well, we have to decide whether we want you or some other investors. And I'm thinking, excuse me? But that, in fairness, that's exactly right. You want to scrutinize and make sure that this is somebody you can live with for the next 5 to 10 years. But as a investor bringing investors in, I said, next time warn me that you had some questions before that happens. But anyway, so those are just a couple tips. A third thing that's happened in the last just few years is there are many more angel groups. Most angels, my first investment was almost 30 years ago at Supercuts. I was one of the early investors in Supercuts. I thought I was brilliant. No problem. I'm just going to go be a investor. Well, the next 10 were not so good. So what I realized, and I think most of us realize, is you want to syndicate, co-invest, share due diligence with other people. I don't care how bright you are, and especially those who are physicians who the real world better than most. The problem is that that's your slice of the world, but then you need a business type, you need a supply chain type, you need a I mean, you start thinking about all the reasons these things go or don't go. So I haven't invested a dime in 10 years without a group of people. And I would say for those who are thinking of being investors, be cautious on your own, even with 2 or 3 buddies. It's very helpful, even if you just join an angel group for a while to learn things and get the hang of it. Every one of them, I know Keiretsu, we now have an 80-page due diligence process, and we'll share it with anybody. But all the research says there's a direct correlation between the amount of due diligence that is done in a deal and the success of that offering. So somebody has to do it, and it's a deeper dive than you might imagine. And I know, Wipro, I'm just out of curiosity, about how many hours do you think you do due diligence before you put in $500,000, $1 million? Yeah. And that's probably after you've already read the due diligence that was already done by one of us angel investors. Yeah. So that's another thing that has changed and evolved over time. Yes. Well, how does the valuation process work? Yeah. Well, that's also changed. Very few angels now do pre-revenue deals. That is a big change in the last few years. So you're forced again, friends and family, to get an MVP almost everywhere. That's a big change. But let's talk about valuation. Almost always, the entrepreneurs come in with a point of view around valuation. And I can tell you in the last 12 months, the valuations have dropped 30%. They were out of kilter, and everybody will tell you that, there was so much money uh, that the valuations weren't good. And we went for 6 months and we didn't do a deal at all because we just couldn't. It just didn't make sense. Well, they've come down, people are better. The other thing I think people have started learning, the unicorns have confused life. It takes something like 38,000 companies to even get a possible unicorn. So when somebody says we're going to go public and be a unicorn, I just next. 90% of the return you will get as an investor from the entrepreneurial world is because of either a strategic purchase or a financial purchase, but it's an acquisition. It is not an IPO. So when people talk about valuations, I encourage them to think about this little thing. Do you really care if you value something today? And the most common, people come in and they'll say, we have $1 million in revenue. We've got $1 million in financing so far. We're going to get another $1 million. Some were coming in. I had one, and I liked what they had. Based on that data, their valuation was $16 million. Well, needless to say, they came back 3 times. It's now $4 million. I said to them right from the get-go, why are you doing that? Even if you got it, and they didn't, but if they did, the likelihood of a crammed down round when you do that is so high, you will never get people to do something again with you because there's no confidence. So it's better to undervalue a little bit. If you really think you've got a scalable idea, what do you care if it's 4 million or 5 million or even 4 million and 8 million? Sounds like a big deal. It's nothing, because at the end of the day, the only way investors really get much back is when it's a multiple, where do you know the sweet spot of acquisitions right now is a $50 million valuation. A huge amount of the return comes from that level. Well, if you value it at 15 million, and even if you get 50, the question is how much did you put in to get there? So I guess that's an encouragement for those who are thinking about it. Do not over-rotate on what that valuation is. It is so much less important than who it is you're going to be in the dance with. Do they have follow-on capability? Are they the kind of people you could live with? And at the end of the day, have they helped their companies get acquired? It's very important that you work with people that have that whole view. Because if they're just angel investors and they've never had a liquidity event, that worries me. Because they may not even know how to help you, number one. Number two, I was part of a deal recently where the company really almost went under. I mean, it came this close. Had a turnaround, acquisition. It was basically a wash on the first acquisition, the second acquisition. People got their money back plus 1x. And there was, they were all upset, blah, 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 blah. They were so lucky to get their money back. But it's a hard thing to say under those conditions. But so many of these companies come so close to not giving people's money back at all that I say, I had one, and I said to them honestly, I said, if you are investing in healthcare just for a financial return, please don't do it. I guarantee you, if that's what you're wanting, if that's what you need, that's what you want, there's lots of better places to make money. I guarantee you. It takes somewhere between 40 and 80% longer in healthcare to do anything. The acquisition cycle for the strategics is longer. You start looking at all the hurdles on healthcare. If you don't have a mission orientation as part of your view, I just encourage people to rethink it. Even the strategic investors, and if anybody's interested, if you give me your card, I'll send you an article I wrote last year on the corporate venture side of healthcare. Just in the last 5 years, there's over $1 billion that has been put into healthcare venture funds in the corporate world. The Ascensions, the Trinities, Providence, et cetera, et cetera, et cetera. And they're very serious about it. The bulk of them want to be strategic investors. In other words, they want to bring what you have. Not only do they want to put money, they want to bring it into their system and cause change. That's good news, right? The bad news of that is their system fights it. How many surgeons are going to sign up while they're still on fee-for-service to do this? Not many. Now, once they go into value-based care and they're in a capitated world, oh, you know what? Come on in. But so many of these things right now are caught between the fee-for-service world, which is a pay-per-view, versus all you can eat. And it's a huge difference. So even when you've got something good and they're ready to finance you, trying to get their own organization to bring you in and prove the concept and scale it is very difficult. So it just means, and I don't want to discourage, I just want people to be realistic. Jerry, you've probably got 18 stories about working in there. How many companies have you taken into the world? Yeah. It's just much tougher. Now, the good news, once you get in and once you get traction, then Katie barred the door. But it's a caution. So when people come in and say they only need $500,000 or $1 million to bring something into the healthcare market, and they don't see that within 12 months they'll need another 3 to 5, and then to really scale into the large health systems, they're going to need 15 or 20. I just get nervous for them. And unfortunately, we're seeing a lot of that right now. Jerry? Yes. Yeah, no, actually, that's across the board. Yeah. Actually, healthcare never was quite as bad. So the good news is we didn't have to adjust as much, but it just, again, people are much more cautious. Other questions? I want to make sure you have time for questions. Yes.
It's very interesting to me for a long while. So for me, it's been a several-year journey, and I've actually declined investment a couple of years ago because we didn't do a beta test yet, and that pissed somebody off really badly because I'm from Russia, just different perspective. I don't believe any money is free. And lately, so when we just onboarded first paying customer, we have 5 more that would like to pay, but I told them to hold off, which is also surprised some people. This is last weekend in Nashville. I was invited. Somebody shared this. They said, well, when you go with an investor, whether it is an angel or VC firm, it's not so much like getting married, but it's like having babies because the face of your baby will change. There are some investments, no investments ever free. And so if they're there just to turn you around, that's not healthcare. It's going to take time. If you want to sell to large healthcare systems, that's what, 2.5 years? You start conversation now, hoping to close that deal by 2.5 years. And it's very important to find a strategic partner that cheers for you, that wants to work with you, that finds the time of the day. So as an entrepreneur, I've realized that actually I am also in position to interview investors, angels or not. And I really want to people who understand the value that will be by my side. And I am in position to choose as well.
Yes. The question was what kinds of things, either myself or just I can talk about the angels. Um, I don't believe most of the biopharma, biotech belongs in angels. Every once in a while, we just had one that we invested in, Savara, that just got purchased. So, you know, every once in a while you have a good outcome. But I think most of the time that's the VC world because the dollars are just beyond what angels are comfortable with. What's going on right now, and I know for ourselves, we are very involved. We have uh, two things we're looking at. We want to find medical products mainly that can be utilized here, but we have a great interest in the emerging markets. So if they come from there to here, or we think we can go from here to there, they get a priority. So we've got two right now that we're investing in that have some significant potential. One is a blood transfusion kind of a process. The other is a behavioral health kind of a product. Biosensors are very interesting right now, and we'd like to be in the ground floor of those. So we're working with a company right now that they they built it, and they're working with Nike and Under Armour and so on to put the biosensors into clothing. In their application originally was for athletes, college athletes mainly. Well, we're interested in the application, obviously more broadly in healthcare, but we're working with them there because one of the problems they do have, of course, is healthcare in the athletes, and it's a very costly situation. So, biosensors. We're also working with an AI kind of a company in radiology because you can imagine, and you probably can speak to this. Uh, a good radiologist, you only have so much time in the day, and you see uh, the scans that you see, and you deduce from that just from your own experience. Well, it's a very good application for artificial intelligence to start working. It's still embryonic, but to be able to look at thousands in a much more effective way. So we're looking at the application of AI in things like radiology. We also, this has been a new phenomenon. my vision, because that's the way I've been doing angel investing for the last 15 years, is what I call outside in. The entrepreneurs come into the health systems or to the angels, and they've got whatever they've got, and we decide to invest. As I've worked with the corporate venture people, and I'll give you one example, it's public knowledge. When I was at Mayo last week talking with a lot of the corporate venture folks want to commercialize things they have. And so we're now beginning to look at that and help them. But an example, and it was just because I had a family situation recently where somebody had to have a liver biopsy. It was very painful. It's still only 80% accurate and so on. Well, Mayo has been sitting on an alternative approach to this for 2 years. They've got 1,000 physician uses on this. Tremendous excitement by their own docs, and a 92 and going to 98% accuracy, where they can bypass the 8 different biopsies to one because of some targeted MRI. So again, we're looking at these kind of things have to get out. I mean, it's frustrating to me. We can't get this stuff out into the system. So those are of great interest. It actually is almost the opposite, because in the old early days of angel investing, you had a lot less knowledge, a lot less rigor around due diligence, and there wasn't nearly the amount of money. So it was a very unsophisticated world. And I never saw a deal beyond $1 million in the angel world in the early days. Now, what's happened is you see many more $1 to $5 million, but now you've got more rigor around it. It's all group work. Everybody, LSA, the band, Karetsu, we all syndicate, we all co-invest. So that gives everybody a little more comfort that a number of people have looked at this. And the more people that look at it that have experience, you actually feel more comfortable. So I think the reason this is happening is that there was a void, and the venture folks, because they've got these really very large dollars that they've got to apportion to things as quickly as they can, they don't belong down here. It's not a real good use of their time. Having said that, from an investor standpoint, you have a much higher likelihood of making money as an angel investor than you do as a venture investor. So the other thing that's happening, another new trend, and we did it at Karetsu. I've been a member for 15 years. For 14 of those, everybody invested individually. So a company would come in, there'd be 100 people in the room. 20 would say, I'll sign up for due diligence. 10 would say, by the end of that, I'll put in X amount. Everybody just wrote the check to the company. Now what occurred, and I think it's because Karetsu's gotten so big, it's almost 3,000 members. Again, significant number of those folks are either not professional investors, or they're dabbling, or they're just curious and they're 65 years old wanting to keep in the game and do one thing a year. Well, then maybe it's better, and so we formed something called Karetsu Capital. And what that is a fund. And we take any of our successful investment companies from the work that was done anywhere in the world. If they've gotten funding from Karetsu members and a full due diligence, we will look at them to top it off as Karetsu Capital. Why? Because many of them need a little bit more, and many of our LPs would rather put, say, 100,000 into a fund, which then we're now on our third fund of the fund, and in the first 6 million, we invested in over 60 companies. So the odds are better for everybody when you can diversify like that. If people, I'll never forget when I first started, and people said, "Oh, if you can't do 20 companies, don't bother." Now they're saying if you can't do 100 companies, don't bother. So the problem with all of this is the odds aren't great. If you're an entrepreneur, it's tough to get it. If you're an investor, pretty small likelihood of getting a return of substance. The other day I was with a bunch of investors. I said, "This is a good company. It should get out there. It's solid. They've got funding. Expect 3x." And this one looked, he said, "Why would I do that?" And I said, "Because it's 0.5% higher than 90% of anything you're going to look at." But I was just telling the truth. Everybody else saying, "Oh, 10x, 20x. Look at the data." That's not the case. So part of it is make sure if you're investing to have people tell you the straight scoop. And if you're trying to get money, don't talk about 10x. Really, all of that's mumbly dust. Try to, the other thing that, again, is worth thinking about, those of you who are inventors, there's a lot of things out there that you don't have to get people's money because they're lifestyle companies. There's some really good companies that are $1 to $5 million companies, or even 10 million. They can live comfortably without getting other people's money and having them muck up all the board and the decision making and everything. So I say to people, when I hear some of these, I think, "Oh, that's a lifestyle company. Get your family and friends involved. Have a good time. Don't bring outside money in." As soon as you bring outside money in, it's a very different dynamic. So again, I've turned a lot of people away to encourage them to not do it until they absolutely believe. Don't do it unless you really believe you've got a $50 to $100 million opportunity within a reasonable range, because much less than that's going to be tough to get. And if you get venture people, and how many venture folks are in the room? I thought there were a couple, yeah. You will know. The venture people have to take a higher percentage. The only way they can get the returns that they need for their LPs, they've got to have a higher percentage of your business than we do. So when you're ready for that, and you need and want venture money, and you think you can be a $100 million business, then you don't care that you're going to give up 20 or 30%. But again, don't do it too soon. The range is a $500,000 to $1 million for a seed round, and between seed and A, it'll be somewhere between a $500,000 and $5 million. So again, the ones that have done it the best to me are those that kind of take some $500,000 chunks. They've got their milestones. They meet the milestone. They come back. Here's your next $500,000. You don't have to go out to 85 more people. The same people tend to re-up if you do that. So those are the ones that seem to do it best. And then once you've got your 4 clients, customers ready to go, and you can see it. I've got one right now I've been working with almost 2 years to help them get where they are, and they've taken small chunks. They just got a $6 million PO. Now it's time. Now we go for bigger dollars because it's a proven concept. As soon as the market tells you it's ready, then I'm ready. Okay. Okay. Well, if you're going to be a true group, there are some angel groups that only invest together. So you don't want it so big that if you got 50 people, and again, it gets tricky. Keiretsu has a different model. Their model is you come, to these various meetings. It's like Shark Tank. They have deal screening done early, so we get 50 or so pretty good things a month, and we cull it down to 10 in the deal screening and 4 at the meeting. But then they invest individually. Well, there you don't. In fact, the more the merrier, because you've got people to do due diligence and so on. So, but if you're thinking about investing together, which I happen to be always cautious about, but if you have, in your case, you actually have an interesting community. You're knowledgeable. You're in the industry. You've done well, or you wouldn't still be there. So you have some reasons that it might work. But even there, I think I would form an LLC for every major investment rather than have everybody do everything together.